So you are one of 5 of the board-certified plastic surgeons at Plastic Surgery Northwest. Can you start by telling us who you are and what you specialize in?
Yeah, of course. So I'm Emily Williams, and I'm one of the original founders of Plastic Surgery Northwest. Dr. Wheeler and I started this practice back when we were in residency so many years ago. We settled here in Spokane 16 years ago and started the practice, but started working on the concept a couple years prior to that. So it's been a long time that we've been working on this. In terms of my personal interests, of course, plastic surgery has always been my passion, and the diversity of the specialty is something that really drew me to it in the first place. But as I've gone through my practice, I really have developed a focus on breast and body, whether that's cosmetic or reconstructive. So breast reconstruction after mastectomy, I have a really specific passion towards microsurgical breast reconstruction. I think it just is an excellent technique to give women something that really feels natural and as much like their own natural body as possible. And then breast and body cosmetic surgery. And my passion is really for women whose bodies have been changed through circumstances like childbearing, weight changes, aging, which I think all of us can really appreciate, and who have worked so hard to get themselves back to something that feels comfortable. But as we all know, there are things that you can't change on your own no matter how hard you work. So it's really, really rewarding for me to be able to give those ladies back something that feels really like them.
Let's go back to the beginning. Tell us a little bit about how you grew up and if there were any early experiences that kind of shaped your interest in medicine and then also plastic surgery.
Yeah, sure, of course. So I always laugh about my early childhood. I am always a lifelong resident of the Pacific Northwest. So I grew up here experiencing the outdoors. I could swim before I could walk, and we were in the mountains from the time that I was a tiny little baby. Growing up was kind of like growing up in the X Games. So for example, my dad taught me how to rock climb when I was a toddler, and I was climbing door jams at a very early age, and we kind of kept that up doing all kinds of adventurous things. For example, my brother went to the Naval Academy, and when he was doing their mini version of basic training, he was laughing about it because that's what my family does on vacation. I think that brought me a sense of adventure, also composure in the face of things that can be really challenging. I think that sense of looking for things that are challenging and really working on achieving to the highest level is something that drew me to surgery and then to plastic surgery specifically.
Walk us through the early part of your medical career.
Yeah, of course. So I went to medical school at the University of Washington, and I was incredibly fortunate, especially now that I do a lot of mentoring and talk to people who are working so hard to get in, because I managed to apply to just one school one time and was accepted, which is truly a miracle when you think about it. I really appreciated my education at the University of Washington Medical School, and then I was fortunate to be able to stay there for my residency, which was fantastic because it's one of the premier residencies in the country, and my education was second to none. You know, whether it's the experiences that I had in trauma at Harborview or the experiences that I had in oncology at the University of Washington, there were so many different ways that it really expanded my horizons and allowed me to achieve to the highest degree that I felt capable.
Were there any specific moments during residency training, medical school, that shaped who you are as a surgeon today?
You know, some of my most formative experiences, honestly, were at Harborview. It is such an intense place to work. It was a training circumstance where you were allowed as much independence as you could handle. That, for me, was really an amazing growth opportunity. You know, you always had people who were there to help you, but you needed to know where your limits were and ask. That allowed you to really figure out a lot of things on your own. One of the really famous statements that Dr. Wheeler and I still quote to each other is one of our senior attendings would put you in a situation and just say, don't fuck it up, and walk away. And so you had to make sure that you knew everything that you needed to know and to do a good job. It really prepares you for the maturity that you need when you start into practice. I truly don't think that, you know, settling here in Spokane and beginning the practice would have been something that was possible without the intensity of that training. So, you know, while it was something that was extremely intense and really took over my life for those several years, I wouldn't have it any other way.
So tell us why plastic surgery? Why was it so appealing to you?
Yeah, it's an interesting thing. I had never thought about plastic surgery before I was in medical training. And in fact, I had a great plan. It just didn't work out to be the plan that was the right plan for me as things went along. And initially, my plan had been to go into family medicine and then do a sports medicine fellowship and do the non-surgical care of kids that had sports injuries, because that was sort of my past and my history, and something that I still really appreciate. But as I went through medical training, I was exposed to surgery, and it was really like getting struck by lightning. Like, it was an immediate passion. It was something that I really felt like I had to do. And then I got really analytical about what surgical specialties were ones that would be rewarding for me over a period of decades. The two things that I ended up really debating between were trauma surgery and plastic surgery, and they seem very discordant, and they are in a lot of ways. One commonality between the two of them is that they both require a lot of thinking. Whatever patient it is that you're encountering, they're coming with their own unique challenges, their own goals, and you need to treat that person as an individual and be extremely thoughtful about how you're handling them and what their needs are. The thing that ultimately caused me to choose plastic surgery is just the positivity of the specialty itself. Unlike so many other things in medicine, plastic surgery is something where you are meeting somebody and helping them to improve on their circumstances. Whether that's a situation where somebody has been facing a cancer diagnosis and is in a really difficult position, or if somebody has been working really hard on their own and just unable to achieve their aesthetic goals, you're meeting that person, you're identifying what their needs are, really talking through the details of what their lives are like and what their futures are like and what's really important to them, and getting to understand them as a person, and then using your tools to help them achieve what it is that they want.
So you spoke to how unique all the different patients are in plastic surgery. Do you have a story that is the most impactful so far? I know there's probably so many.
It is hard on a number of levels. One, because each of my patients are people that I appreciate as individuals. It's hard to compare one story to another, truly. It's always difficult for me to talk about this as well, just because of the fact that I really am respectful of people's privacy. I want to make sure that I'm not sharing anything that is too personal for anybody. But one of the things that I am constantly just amazed by is the resilience of my patients in the face of really overwhelming adversity. I meet a lot of women in circumstances that are circumstances that you would never wish upon another person. Young people who are faced with very scary and very serious cancer diagnoses, and they pull themselves together and manage to really gracefully handle chemotherapy, surgery, changes in what they think is going to be coming. And I think it's that, we don't always know exactly what this trajectory is going to look like. And I know that that's something that's a very difficult thing to handle when you think you're dealing with one thing and then all of a sudden you're dealing with something else. And just as soon as you get a handle on that, something changes again and you have to pull yourself back together and deal with what that next thing is, oftentimes far beyond the bounds of what you think you could do. And so I'm just so impressed by people that manage those circumstances.
So plastic surgery is a broad field of medicine. Can you tell us the kinds of people that plastic surgeons take care of?
Sure, absolutely. One of the phrases that's oftentimes used for describing plastic surgery is that plastic surgery is surgery on the skin and its contents, which basically means your entire body is in play. And there are very few surgical specialties that operate on every single part of the body, from the top of the head to the bottom of the feet, and every age, from literally newborn infants to our most elderly. So for example, one of the surgeries that I do is something that's called a myelomeningocele repair. So babies that are born with spina bifida, a defect in their skin with their spinal cord exposed, is something that a few of us here in the practice do. That literally means taking a baby that can be within 24 hours of delivery and doing a surgery on them. We can also do surgeries on people that are well into their 90s. There's no gender, there's no age that limits us. We basically are there if our patients need us, and we serve really as a reference for other surgeons as well. When other surgical specialties are doing something and end up having some sort of a challenge, oftentimes with wound healing, maybe it's a cancer resection that has gotten too big to close, or it's a complication of another surgery, they call us to help us fix that problem.
When you think about being a successful doctor and a surgeon, what does that actually mean to you?
That is a great question. And I think success is something that changes over your life. Of course, being able to perform surgeries with excellence, being technically excellent, being really capable in terms of making the right choices clinically on behalf of my patients is something that is extremely important and is an absolute necessity when it comes to success. But I think other components of that are learning more about your patients, learning more about what's important to them, learning how to talk to them to make sure that you and they are on the same page and that you're facilitating a plan that is the most successful plan and leaves everybody in the most comfortable position going forward. And then, surgery is just like every other specialty or career in some ways where there is the constant battle between your professional life and your personal life. And that's something that I think you never really find a balance per se. It's a little bit like a teeter-totter where, a lot of the time we'll be more drawn into the professional components of our lives and maybe neglect personal life a little bit. But that is something that is extremely important to me. And I think I'm going to spend my entire career trying to figure out where the right balance is.
I know that keeping up on your craft is important to all of you here at PSNW. How do you stay involved in research, new techniques, and just staying on top of plastic surgery?
Yeah, definitely. So I'm a big reader. I'm always reading the new publications about surgical techniques or studies that have been done, recommendations, and really trying to stay abreast of what the new developments are in the specialty. I also read widely outside of our specialty. So, trying to figure out some of the nuances of what's coming in medicine in general. Some of the things like immunotherapy or virus-driven targeted treatments of cancer. My hope, like everybody's, is that one day maybe we're not needed for cancer reconstruction anymore because we have a better way than surgery to treat that. I read a lot to try to stay on top of things. I also network quite a bit. So I have a lot of colleagues that I stay in close contact with. And, when you're fortunate enough to have colleagues that are also at the top of their field, it gives you really good insights into what's going on. And then, of course, I engage in leadership roles, both in terms of our regional societies and our state societies to stay in contact with the rest of the specialists in this area.
Amazing. So you're a leader outside of your business, and then you're a surgeon here, but also a leader within PSNW. Why is it important for you to take on a leadership role here, and what does that mean to you within the practice?
I think leadership really has a lot of components to it. I think the first thing that is important about being a leader is having a vision, having an idea of how you think that things can and should be done. For me, that's not something that is authoritarian. It's something that's collaborative, whether it's with my partners or other medical specialists in the area or my patients. But I think really having that idea of what's the right way to do things and then having the motivation to carry it out. When you feel like you have a vision for something, for me, it would be really difficult to say, well, I think this is how to do it, but I don't really care enough to actually do it. That's not the way that I've ever viewed anything. If there's something that I think can and should be done well, I'm going to work my hardest in order to make that happen.
What do you have for goals for 2026 as a surgeon and for the practice?
Sure, definitely. So as a surgeon, of course, we want to make sure that we are providing the best care as we can throughout the community and the region. One of the missions that we have is to grow our access for patients that are maybe further outside of Spokane. So doing more outreach to areas like the Tri-Cities or Walla Walla or even Missoula, Montana. As we meet more patients from those areas, there's a greater degree of interest and collaboration between myself and my partners and other specialists in that area. And so we really want to continue building our ability to reach patients that need us in different areas. So that's something that I'm working on personally. Also, of course, is a goal for PSNW.
So Plastic Surgery Northwest is quite a powerhouse in the industry. Tell us a little bit about what sets you apart as surgeons here.
Yeah, Plastic Surgery Northwest to me is amazing. And I think it says a lot about the personalities here that each one of us has been trained really at the top of our game. We've been fortunate to attend the most prestigious residencies and fellowships, and then we have brought those strengths together. And rather than having that be something that is competitive, we've made it something that's collaborative. And we've used it to make each one of us and the practice better and better. Plastic Surgery Northwest truly is amazing, I think, in terms of what it is that we're able to offer. So you wouldn't think that in Little Spokane, Washington, we would do more microsurgical breast reconstruction than almost anywhere in the country, but we do. We have built this amazing team that between the surgeons, the PAs, and the other support staff that we have around us, we are able to do amazing surgery, and a lot of it, which is what you want to find when you're looking for something that is that technically challenging of a procedure. Of course, there's more to us than microsurgical breast reconstruction. We are able to offer really top-notch care in cosmetic procedures, whether it's face, breast, and body. We have an ambulatory surgery center that's a part of our building here that offers seamless care between the clinic and the ASC. We have an amazing team of nurses and techs that work with us. Our anesthesia team has been doing exactly this kind of procedure for decades, and everybody's extremely experienced. So, whether it is the volume of surgery that we do, the quality of the training of the doctors that are doing it, or the team that we surround ourselves with, everybody really strives for excellence and everybody supports each other in order to achieve that.
So Plastic Surgery Northwest also has a Spa Pavone. Tell us a little bit about how you incorporate those two things together for your patients.
Absolutely. So Spa Pavone is unique. It is definitely different than a standalone med spa or just general spa in the sense that we have this really unique patient population and unique way of looking at our patients. We're not just trying to sell, not to disparage anybody else's med spa, but the newest, lotions or treatments, but we're really thinking about it in the sense of how do you care for somebody comprehensively? We're able to perform surgery with excellence, and it really helps us to have a spa that's focused on the excellent care outside of surgery, whether that's our estheticians who have really worked hard to develop scar therapies, whether that is laser, microneedling, silicone treatments. We can do Kenalog injections, all kinds of things to mitigate the aspects of surgery that maybe are the least happy things to have as a result. We also work together to make sure that as patients are preparing for facial cosmetic surgery, that they're really optimized. You don't want to have the foundation of your face be perfect and then the paint to be peeling. So it's really important to be having good care throughout that whole process, working on skincare as well as the foundational aspects of your facial aesthetics.
Plastic Surgery Northwest has a state-of-the-art facility here in Spokane, and you really deliver high-quality patient experience. You are working on extending that experience to those traveling from out of town and really making it a comprehensive, all-inclusive, well-cared-for experience for your patients. Tell us a little bit about what that looks like.
Absolutely. So, it's pretty amazing when you can come to work in the morning and walk into the building and just be like, this is amazing. But we truly have that experience here when we do arrive at work. We have just accomplished a big overhaul of our clinic space, and you'll feel that freshness and that newness and really just the experience of being in a place that is state of the art, cutting edge, and really respectful of what your experience should be. So for me, it's a pleasure every morning walking into work. Of course, when we think about the patient experience, it is more comprehensive than just that physical space. It's each interaction that people have from the first time that they pick up the phone to the time that they greet the receptionist at that front desk, and then all the way through the process. And one of the things that we're being really thoughtful about is how do we extend that experience to people who are maybe traveling long distances? One of the first things that we do is we really try to meet people where they are. One of the things that was very fortunate for us coming out of COVID is that we developed a much stronger telemedicine presence, which allows us to meet with patients remotely, get to know them, and then minimize the hassle of travel. We know that it's hard if you're driving from hours away for your visit, and we want to make that worth your time. When people do come to Spokane, we want to make that an experience that is as comfortable and as safe and beneficial to them as we possibly can. Things that we're incorporating are collaboration with local hotels, Airbnbs, food services, even support services like hairstylists or pedicure, manicure technicians. Like, I don't know about you guys, but if I was laid up after surgery, I would definitely want all the bougie TLC. And so we're trying to find that same experience for our patients so that, if you're traveling in from Montana, for example, you know where you're going to be staying, you know that you're going to be supported, you know that you'll be able to have access to us easily and as frequently as you need to. And then by the time that you get through your recovery and you feel comfortable going home, you know that you've accomplished what you need to while you're here.
So for potential patients listening, how can they find you, follow you, or get in touch with you about consulting for surgery?
Sure, absolutely. So probably the fastest way to get a hold of me and find out the details that you need to know would be the old school picking up the phone and giving us a call. I know that can be intimidating, but we have a wonderful staff that is able to talk with empathy and figure out what it is that you're looking for, help you understand what is the best way to get through things, and start giving you some good ideas of what your future may look like with our practice and get things scheduled. So that's a really fast way to do things. Of course, there are other ways to do things. Reaching out to us on our website or my Instagram are things that are great ways to start to make contact and get to know who I am and who the practice is. Find out a little bit about some of the procedures that we do if picking up the phone feels a little too intimidating out of the gates.
Okay, well, thank you so much.
Yeah, my pleasure.